Macular Degeneration by the Marthas. Disease process for macular degeneration involves deterioration and scarring within the macula, which is the small area of the retina responsible for central and color vision. There's two types of AMD, dry atrophic and wet exudative. Dry causes photoreceptors in the macula to fail and are not replaced because of age, and wet retinal tissue degenerates, allowing vitreous fluid or blood into the subretinal space. New fragile blood vessels form angiogenesis, and this compromises the macular tissue, causing subretinal edema, and eventually fibroscar tissue forms, severely limiting central vision. Signs and symptoms. Early macular degeneration is often asymptomatic. People usually have the condition in both eyes in varying degrees. Vision loss is often noticed as difficulty with reading or driving. Vision loss can occur in one or both eyes, described as blurred vision, distortion of straight lines, and or empty spot in central area of vision. And sometimes patients have decreased ability to distinguish colors. And then I also included a little picture of the macular degeneration of vision for normal eye, for dry macular degeneration, and for wet macular degeneration. So if your eyesight looks like that, you probably need to go to ophthalmologist.
Some diagnostic tests for macular degeneration can include an Amsler grid, which is an at-home test that helps detect any distortions such as wavy lines, blurred vision, or missing spots. A visual acuity test checks your central vision at different distances. An ophthalmoscopy lets the doctor examine the back of the eye to check for any signs of AMD. An optical coherence tomography, or OCT, is an imaging test that captures cross-section views of the back of the eye, particularly the retina. And finally, IV fluorescein angiography is a fluorescent dye injected into the vein that helps identify abnormal blood vessels in the retina. Moving on to medications and treatments. There are currently no treatments for dry AMD, so we want to focus on slowing or preventing vision loss. In order to do so, we want to encourage a diet rich in fruits, leafy green veggies, fish high in omega-3s, nuts, and whole grains. If patients are advised to do so, they want to take vitamin supplements, and we want to encourage patients to stop smoking as well as going in for their regular eye exams. Telescope implants are for end-stage AMD. This is not a cure but helps improve vision. And the most common treatments for wet AMD is intermittent injections into the eye. Anti-angiogenic medications such as ranibizumab or aflibercept work by blocking or slowing the growth of new abnormal blood vessels. Some less common treatments include photocoagulation and photodynamic therapy.
Question number 1. A client is newly diagnosed with macular degeneration. The nurse should assess the client for which primary clinical manifestation of this disease. A. Blurred or loss of central vision with difficulty reading or recognizing faces. B. Seeing objects clearly in the center of their visual field. C. Sudden painful loss of peripheral vision. D. Halos and blurry vision upon waking up. The correct answer is A. Blurred or loss of central vision with difficulty reading or recognizing faces. Rationale is this is a hallmark sign of macular degeneration, as a damage to the macula impairs the ability to see fine detail directly ahead, which is essential for tasks like reading. Question number 2. Which of the following describes the fundamental difference in the pathophysiology between dry and wet macular degeneration? A. Dry MD involves slow atrophy and drusen, and wet MD involves abnormal leaking blood vessels. Wet MD is caused by drusen deposits, while dry MD is caused by abnormal blood vessel growth. C. Dry MD involves retinal detachment, while wet MD involves vitreous hemorrhage. Or D. Dry MD is caused by smoking, and wet MD is caused by sun exposure. The correct answer is A. Dry MD involves slow atrophy and drusen, and wet MD involves abnormal leaking blood vessels. The rationale behind that is dry MD involves the slow breakdown of light sensitive cells and the accumulation of drusen, while wet MD involves the rapid destructive growth of new fragile vessels, neovascularization, that leak fluid and blood.
Question 3. The nurse is caring for an older adult diagnosed with wet macular degeneration. Which medication does the nurse anticipate being prescribed? A. Timolol, B. Latanoprost, C. Ranibizumab, or D. Pilocarpine? And the answer is C. Ranibizumab. Ranibizumab, or Lucentis, is an anti-VEGF medication used in wet AMD to reduce the growth of abnormal blood vessels in the retina. Timolol, latanoprost, and pilocarpine are all glaucoma medications. Question number 4. The nurse is reviewing dietary changes for a client with dry macular degeneration. Which diet is best to help slow progression? A. High in refined grains and lean meats. B. Mediterranean diet with leafy greens, nuts, and fatty fish. C. Low fat, high protein diet with dairy focus. D. High calcium diet with limited fruit intake. And your answer is B. Mediterranean diet with leafy greens, nuts, and fatty fish. A Mediterranean style diet rich in omega 3s, antioxidants, luteins, and zeaxanthin helps slow the progression of AMD. And finally, question 5. A client receiving ranibizumab for wet AMD asks, what does this shot do for my eye? What is the best explanation? A. It stops the eye from making too much fluid that clouds your vision. B. It strengthens the retina so it does not tear. C. It blocks growth of leaky blood vessels that damage the retina. Or D. It cures your macular degeneration. And your answer is C. It blocks the growth of leaky blood vessels that damage the retina. Ranibizumab is an anti-VEGF medication that inhibits the growth of abnormal blood vessels and reduces fluid leakage, slowing vision loss in wet AMD.